Hello, mortals. I am Dr. Sombrio, and today we're going to uncover one of the most disturbing medical cases ever documented. A case that challenges everything we think we know about human reproduction and the horrors that can grow inside our own bodies. In 1999, at Johns Hopkins Medical Center, Dr. Sarah Martinez was conducting what she thought would be a routine ultrasound on a 28-year-old woman named Jennifer. Jennifer had come to the hospital believing she was pregnant. She had all the symptoms: missed periods, morning sickness, and a growing belly that looked exactly like a normal pregnancy. But what Dr. Martinez saw on that ultrasound screen made her blood run cold. Inside Jennifer's abdomen wasn't a developing baby. It was something far more terrifying. A mass that contained fully formed teeth, patches of hair, fragments of bone, and what appeared to be an eye. What Jennifer was carrying wasn't a baby at all. It was a mature teratoma, a tumor so bizarre and grotesque that it literally grows human body parts inside itself, creating a nightmarish collection of organs that should never exist together. The scientific name teratoma comes from the Greek word teras, meaning monster. And once you understand what these tumors actually are, you'll realize that name is perfectly fitting. Teratomas are tumors that develop from germ cells, the same cells that would normally become eggs or sperm. But instead of following their natural path, these cells go completely rogue. They start dividing and growing, but here's where it gets truly horrifying. They retain the ability to form any type of human tissue. Imagine your body's blueprint getting corrupted, and instead of building a human being, it starts randomly constructing body parts in complete chaos. Hair follicles sprouting next to eyeballs, teeth growing alongside intestinal tissue, brain matter mixed with muscle fibers, all crammed together in a grotesque biological nightmare. Dr. Robert Chun, who has studied teratomas for over 20 years, describes them as nature's most disturbing mistake. In a particularly chilling case he documented, surgeons removed a teratoma that contained a perfectly formed foot, complete with toenails, growing inside a woman's ovary. Let me tell you about the case that made international headlines and forever changed how doctors approach these monstrous growths. In 2008, a 19-year-old college student named Maria visited her campus health center complaining of severe abdominal pain and what she described as something moving inside her stomach. The initial examination suggested pregnancy, but when doctors performed an ultrasound, they discovered something that defied medical explanation. The mass inside Maria's pelvis was roughly the size of a grapefruit, and it appeared to be breathing. Dr. Michael Torres, the surgeon who operated on Maria, later described what he found as the most disturbing thing I've encountered in 15 years of practice. Inside the tumor, they discovered a partially formed spine with vertebrae, clumps of dark, coarse hair, multiple teeth, including what appeared to be molars, tissue that resembled lung material which explained the breathing motion, fragments of what looked like brain tissue, and most horrifyingly, a structure that resembled a primitive eye, complete with lens and retinal tissue. The tumor had been growing for an estimated 3 to 4 years, slowly developing these grotesque body parts while Maria lived her normal life, completely unaware of the monster growing inside her. What makes teratomas truly terrifying is their biological origin. These tumors develop from totipotent cells, cells with the ability to become any type of human tissue. It's the same process that creates a human being, but something goes catastrophically wrong. Researchers have discovered that teratomas contain what they call organoids, many organs that develop in complete isolation. Dr. Elizabeth Harper from the National Cancer Institute explains it like this: imagine if your body tried to build a human being, but someone scrambled the instructions. You end up with random body parts growing in random places, creating a biological horror show. In laboratory studies, scientists have found teratomas containing functioning neural tissue that can actually generate brain waves, hair follicles that continue to grow, requiring the tumor be trimmed during removal, teeth that are so perfectly formed they could theoretically be transplanted, skin tissue complete with sweat glands and hair, and muscle tissue that can actually contract. The most disturbing discovery came in 2015 when researchers found a teratoma containing tissue that resembled a primitive heart, and it was actually beating. But the horror of teratomas isn't just physical, it's deeply psychological. Imagine discovering that what you thought was a pregnancy is actually a tumor containing fragments of what could have been a human being. Many patients describe feeling like they were carrying a failed twin or hosting a monster. Dr. Patricia Williams, a psychiatrist who specializes in treating teratoma patients, explains, the psychological impact is devastating. Patients often feel like their body betrayed them, creating life but twisting it into something monstrous. Jennifer, the patient we mentioned earlier, required extensive therapy after her diagnosis. She described the experience as learning that my body was trying to create life, but instead made a nightmare. Here's what makes teratomas even more terrifying. They're far more common than you might think. Mature teratomas account for approximately 15 to 20% of all ovarian tumors. That means thousands of women are walking around right now with these grotesque growths inside them, completely unaware. The statistics are chilling. 1 in 4,000 women will develop an ovarian teratoma during their lifetime. 85% of teratomas occur in women between ages 15 to 45. The average time before diagnosis is 2 to 3 years. 15% of cases are initially misdiagnosed as pregnancy, and in rare cases, teratomas can grow to over 40 pounds. Most disturbing of all, teratomas can occur in multiple locations throughout the body. While ovarian teratomas are most common, they've been found in the brain, lungs, stomach, and even inside the heart. While mature teratomas are typically benign, there's an even more horrifying variant, malignant teratomas. These tumors not only contain the grotesque mix of body parts, but are also cancerous, spreading their monstrous cells throughout the body. Dr. Chen documented a case where a malignant teratoma spread hair-producing cells to a patient's liver, causing hair to literally grow inside the organ. The patient described the sensation as feeling like something was crawling inside me. In another case, cancerous teratoma cells containing two-forming tissue spread to a patient's lungs, causing calcium deposits that look like tiny teeth to form in the lung tissue. Removing a mature teratoma is like performing surgery on a biological nightmare. Surgeons must carefully extract not just tumor tissue, but fully formed body parts. Dr. Torres describes the process. You're not just removing a tumor, you're dismantling what looks like a failed attempt at creating life. The largest teratoma ever recorded weighed 61 pounds and was removed from a 54-year-old woman in Colorado. The tumor contained so much hair that it had to be cut away in sections, and the teeth were so numerous they filled an entire specimen jar. During surgery, it's not uncommon for teratomas to release fluids that smell like amniotic fluid, adding to the disturbing sensation that surgeons are dismantling something that was once alive. Perhaps the most terrifying aspect of teratomas is how much we still don't understand about them. Why do germ cells suddenly decide to create random body parts? Why do some teratomas contain almost complete organ systems, while others are just chaotic tissue masses? Recent research has suggested that teratomas might represent failed twin absorption, cases where embryonic cells that should have developed into a twin instead became incorporated into the surviving embryo, only to activate years later and begin their monstrous growth. This theory suggests that many of us might be carrying dormant teratoma cells right now, waiting for some unknown trigger to activate them and begin creating their grotesque collection of body parts. Today, with advanced imaging technology, doctors can detect teratomas earlier than ever before. But this has led to a new kind of horror. Patients receiving ultrasound images that clearly show teeth, hair, and other body parts growing inside their tumors. Dr. Martinez, the doctor from our opening case, now specializes in teratoma diagnosis. She says the hardest part of her job is explaining to patients that what they're seeing on the screen, that collection of teeth and hair and tissue, is growing inside their own body. I've had patients faint when they see the ultrasound, she explains. The human mind isn't prepared to see body parts growing in places where they shouldn't exist. The symptoms of teratomas are often mistaken for pregnancy or other common conditions: abdominal swelling and bloating, pelvic pain that comes and goes, irregular menstrual periods, nausea and vomiting, a feeling of fullness in the abdomen, and in some cases, patients report feeling movement inside their abdomen. The most disturbing symptom, reported by about 20% of patients, is the sensation that something is growing inside me that shouldn't be there. Remember, mortals, your body is capable of creating not just life, but also monsters. Somewhere inside each of us lies a potential for our cells to go rogue and begin building horrors that nature never intended. The Teratoma reminds us that the line between creation and abomination is thinner than we dare to imagine. The next time you feel an unexplained pain or unusual symptom, remember Jennifer, Maria, and the thousands of women who discovered they were carrying not life, but monsters made of teeth, hair, and eyes, grotesque parodies of human development growing in the darkness of their own bodies. If this medical nightmare has revealed the horror that can literally grow inside us and made you question what other monsters might be lurking in your own body, leave a like to feed the algorithm that connects us to these dark medical truths. And if you want more disturbing revelations about the nightmares that medicine encounters every day, subscribe to the channel where medical science meets the horror of reality. Until the next exploration of biological darkness.